Good afternoon, Mayor Adler and council members. Today I'm going to let a member of Austin's medical community speak through a video clip. Dr. Jeremy Wiseman, who earned his MD from UT Galveston Medical Branch and practices family medicine, spoke before your predecessors last August, and I believe all of you too should hear what he had to say. Could you roll that, please?
Thank you, Mayor and council members. My name is Jeremy Wiseman. I'm a family practitioner at Wiseman Family Practice. The topic I want to discuss today is fluoridation of water. Now, I know this topic and its potential health effects have been discussed in the past, but I would like to cover a few other issues of concern to me. Now, we first need to establish that fluoride is a drug. The definition of a drug is a substance intended for the use in the diagnosis, cure, mitigation, treatment, and or prevention of disease. In this case, of course, it's the prevention of dental caries. Now, there are many bedrocks of medicine today, but two of the big ones, in my opinion, would have to be informed consent of medical treatment and dosage control of medications. Now, informed consent is defined as the consent to medical procedures and treatments given by a patient after, that's the key word, after the potential risks, hazards, and benefits of treatments have been explained. Now, this principle has been completely ignored with the fluoridation of our public water in an attempt to improve public health, and I believe it needs to be reconsidered. The second issue is dosage control. Now, presently, fluoride is added to water at about 0.7 to 1.2 parts per million, depends on where in the nation where you live. And so this means that everyone from infants to adults get the same concentration. Now, depending on how much water a person drinks, this dosage is highly variable, especially for infants who bottle feed on a water-based diet. If we can't consider taking fluoride out of our public water supply, which I believe is the ultimate solution, then I propose that we have some sort of labeling or education for parents about the potential dangers of dosing in infants and children. Now, I want to emphasize that I'm not actually against fluoride. I actually believe that topical fluoride has its place in toothpaste, for example. And I believe that there's dental benefits for doing this. But the systemic absorption of fluoride through our water supply is an altogether different issue. And I think one that has proven and potential health risks that I think are unnecessary and I think are unsafe for public health. Thank you for your time.
Thank you, Jeremy.
Okay, council, please take Dr. Wiseman's words to heart. There's no possible way to know, much less control, the dosage of fluoride any individual receives through water fluoridation. No other drug is distributed in this way without regard to age, size, or health status. And there are realistic alternatives for supporting the dental health of our underserved children. Fluoride-Free Austin has a number of local dentists, doctors, and otherwise qualified professionals who stand ready to meet with the mayor and our council members with a view to getting a serious discussion going, and that's what we'd like to see.
Thank you very much.
Thank you for your time.
Monica Hernandez Mota.